You do many things, but today our primary focus is going to be your role at West Texas A&M. So thank you for interviewing with Junior Achievement today. We're just going to dive right into it.
Okay.
So first of all, if you would share a little of your backstory, a little of your job story, what brought you to here, how do you earn your living, how did you land here?
Well, I was a student here, first of all. So many years ago, I came as a bachelor student, wanted to be a nurse, and so I started here. And then worked in the hospitals in the different types of settings, and then decided to come back, got my master's degree here, and became a family nurse practitioner. And then, never knowing I would be in this position as the director of the program, went on later and taught a little bit here in the past, and then went on and got my doctorate from the University of Texas. And then now am leading the program here at WT.
So why do you do what you do?
I do what I do because I love people and I love helping people. And I really knew that from early on. I loved doing nursing things. My dad was a pastor growing up, and so I often went with him when I was just little. That was back in the day when we could have visitors in the hospital, and so he would go see his people and I would go with him. And I loved to watch the nurses who were working and as they took care of patients, and that really meant a lot to me. And so I started off at a really young age didn't really know what I wanted to do. I just knew I wanted to help people.
So that is what inspired you.
Absolutely.
Just loving people.
Mm-hmm.
What was your first job in the healthcare field?
My first job was working as a tech at the hospital in the old St. Anthony's, which is downtown. And so we worked in that unit. I worked nights and weekends and kind of all the time, honestly, until I got enough money saved to start nursing and to get into school. And I graduated from a really small high school. Wasn't really sure that I could do college. I didn't really know, all was kind of unknown, but I started that process, and you just do what it takes to get through there. So yeah, that's what I did.
What were your major takeaways from that first job in healthcare?
I knew it confirmed that I wanted to do that. I loved it, even though some of the things that we did weren't the greatest. I mean, you clean a lot up, you do a lot of things. Patients are not their best when they're in the hospital. They're sick, they don't feel good, they're cranky, they don't want to be there, it's expensive. I mean, there's all these things that they have going against them. But I love that I had the opportunity to make or break their day. Even as a tech, I didn't have to be a nurse or a doctor at that point. You could still make their experience really good by just taking really good care of them and meeting their needs and seeing what they need.
I love that. Again, loving people well. Well, we'll come back to that. So kind of just take us through, what does your typical work day look like? And also you can discuss, I know that you do have your hand in some other ventures, so kind of you can discuss that. Like, I know you're pretty busy. So what's your average day look like?
It varies every single day, and every day is a new day, and I love that. I love a lot of excitement and different things. I'm relatively new to this role. I started last fall, so in August. So I'm still kind of getting the kinks worked out of what I should be doing and what I'm doing. But as far as the director of this program, I just make sure that all the classes are being offered and the faculty have what they need to instruct the students, and that everything's going well. And of course, there's a lot more to that right now, making sure everybody's safe with COVID, making sure we have the supplies we need, making sure our students are safe and they're getting the education that they need. And we're just following our state guidelines, our federal guidelines, and our certification guidelines for all levels.
New normal. I mean, you never really totally experienced the old normal. You just are learning the new normal from the get-go.
Correct. And so I know, as everybody is, we've experienced a lot of change, and 2020 brought change probably for everyone, not just us. So I'm good at adapting through that, so I think that's really helped. As far as my other things that I do, and what kind of brought me here, honestly, is that whenever I graduated from here for my family nurse practitioner, I started clinics out in the rural areas for people who did not have access to care. So we have a number of clinics in counties who have nothing else. So we are the only place for them to go. And we operate those clinics with nurses and nurse practitioners. And so we serve the populations of smaller counties. And a lot of times when you're out in the rural areas, it's not just that county, it's like the surrounding counties as well. So we provide access to the care for those different populations. And when WT was looking for a department head for the nursing department, I guess I kind of came up because one of their missions is to really make sure that nurses are not just concentrated in Amarillo, but actually concentrated more throughout the Texas Panhandle. And so I can help with that because that was really my mission, was to make sure people had access to care and that I could bring nursing to that. And so really we're doing that in collaboration right now.
That's incredible. And it's a little more affordable than here than if they just went to, a big box hospital.
Absolutely, absolutely.
So in middle school, because you were talking to primarily middle and high school students.
Okay.
So in middle and high school, did you have any career interests? If so, what were they?
I did. So while I loved going to the hospital and seeing patients and helping patients, I really loved law. And I loved, and I wanted to be an attorney, so I loved that. I'll tell you what happened is when I went to college, I did a little bit of an internship with an attorney, and this is not disparaging to any attorneys, but I sat a lot, and there was a lot of paperwork. And I'm one that likes to move and do. So after I did this little internship, one night I was sitting in a dorm, and this girl came in, and she was like rubbing her feet, and she was saying, "Oh, my feet." And I was like, "What's going on with you? What'd you do?" And she was a nursing student. And she said, "I've been on my feet all day long." And I said, "Well, what are you doing?" And she said, "I'm a nurse." And she started telling me about it. And I was like, "Oh, I just want to get on my feet." I was so tired of sitting and going through paperwork. And so really one of the things was like, I don't want to do paperwork. I want to be doing something and helping people. So I kind of shifted my career a little bit to include nursing. Now, I still love policy and I love law, which makes
work together.
Yes, absolutely. It's a great fit together. Yes. And I have done that. I have done a lot of the policy intertwined with nursing because nurses need help too. Yeah. And so being an advocate for policy in the nursing realm has been so helpful and important. So really, it's two things that I love that I got to combine, but especially being on my feet.
So what you previously, when you mentioned working at the old BSA as a tech, and the importance of job shadowing. Just cannot undermine that. I mean, I can't highlight that enough. Our students should shadow. And if they wanted to shadow just in a regular career, do you know very much about that? Like how difficult is it if they wanted to shadow at BSA?
Oh, I think it's definitely available. Almost any professional, if you approach them and ask them, "Hey, I'm kind of interested in doing what you do." We love what we do. So, I mean, rarely would anybody say no. It's like, "Yeah, for sure, come on, let me just show you this." And I'd advise it as well, because you don't want to spend all this time prepping for something that you decide, "I don't really like that," And so for me, that was sitting in a file room all day long looking through charts. I was like, I want to do more than this, and understandingly they do more than that, but on TV you always see court or law or some action. Yeah. And this was a lot of paperwork and not so much action.
Real life.
So yes. So I think doing that gave me that opportunity to know, maybe I don't want to sit behind a desk, forever. And maybe I want to do something that to me was a little more meaningful in taking care of patients and things like that.
So I'm going to take a different turn.
Okay.
At what point in your high school career, to follow the career path that you have followed, did grades become really important? At what point did you say, "Oh my goodness, I really need to focus on GPA"?
Well, that's a great question. So grades are important no matter what career you go to, honestly. So very important for nursing. Nursing is so competitive. It is difficult to get into programs for nursing, so the difference between an A and a B is really important. It really is, and it starts at high school, because if you develop that as you're going through middle school and high school, by the time you get to college, you've already got that discipline in to help you get those grades that you need in college. And really, it will be a difference between you getting accepted into a program that you want and something that you know, that, okay, well, I'll settle for this,
Right.
versus what you want. So
Right.
I think from honestly, from just junior high, knowing kind of, okay, no matter what it is, whether it's nursing or medicine or law or, you know, business, no matter what that is, if you just do your best as you go through those programs, then as you build those skills and the knowledge and the study skills, there's no limit to what you can do. You know, absolutely.
So, if a student listening to this were interested in a career in nursing or anything in the health field, healthcare field, what should they be doing right now to prepare? We just sort of hit on that. But.
Sure, yeah, definitely grades, watching the grades, getting a little bit, I think the job shadowing is important. I think them seeing, and not just nursing or a doctor, I mean, there's a ton of valuable healthcare opportunities. We have a health science degree here that allows you to get a basics and a bachelor's degree in health sciences. For those who may know, like, I want to be in the healthcare field, but I'm not so sure that I know what I want to do in the healthcare field. And so there's a lot of different avenues. There are some business approaches to that where they can do business management in healthcare. There are helping with clinics and running clinics and organizing things like that. And then there's also like the medical aspect where they maybe not a nurse, but just like an assistant to someone. So there's just a lot of different opportunities. Marketing, I mean, there's so many opportunities in healthcare field. Sometimes they're medical assistants, so certified nursing assistants, medical assistants, patient care specialists. They have lots of different names or titles.
Okay.
And a lot of times, if you know you're going to go into the healthcare field, a position like that would be great for you because you get a little bit of that experience. I even tell people that work in the reception, you know, area, like in some of my clinics, people who want to go into healthcare, I'll have them work reception because really just taking those phone calls and working with people and getting used to that and the language we use and, you know, some of the little things that we use abbreviations for all the time that people don't understand, just hearing those and being around those, they start developing what it is about healthcare. And then they either know, yeah, this is really cool and I want to continue doing this, or they're like, oh, that's not what I thought it was going to be like. Maybe I don't. Or the first thought of blood, they, whew, you know, this isn't for me. So, but it helps because just putting yourself around that in that situation, they can learn those. So there are, you know, we also have speech pathologists, we have hearing specialists, audiologists, programs here. We have sports and exercise science. So people who like athletes or somebody who loves working with the athletes and that motion and things like that. And of course we have, even not to limit it to nurses, but we have nurse practitioners who go on and get their master's degree and become family nurse practitioners where they do take care of patients. And we even have psychiatric nurse practitioner program now where they can actually provide psychiatric care for.
Which is a booming industry.
We need them so bad, so desperately bad.
So for the, I'm not necessarily a receptionist, but the girl that takes my temperature.
Sure.
What's her degree look like? Like what kind of cert does she have? What kind of schooling is behind her?
That's a great question. The schooling behind somebody who does that, it depends on what they are. If they're a certified nurse assistant or patient care specialist, something like that, typically they can get that in high school if the high school has a program that will help cater to the health field. Okay. So my daughter, for instance, did a program similar to that, and they start kind of their freshman year taking some basics, and then by the time they graduate, they are eligible to sit for that certification exam, which puts them as a clinic care specialist. And that's one way that you can actually,
high school,
high school, absolutely. Another way that they can do that is a lot of times the nursing facilities, nursing homes, and different facilities like that, some of the hospitals actually will train their patient care specialists. So they know that this person is going to go into healthcare, wants to go into healthcare, so they can train them in those skills and work them into that. So usually they've graduated from high school and maybe they're at that interim between college or thinking about going to college, or maybe they're doing college at the same time and they need a position. That is what I would recommend, is getting into some type of facility or environment that can train you, and you kind of work your way up. Through all my degrees, I had to work all the time. It wasn't just like school and nothing else. I mean, I had to work full time, and so the great thing about healthcare is everybody needs it 24/7. So you can work nights, you can work weekends, you can make it work. And so you just do what you have to do, but that's kind of what that is. Now, some places and facilities will also have a nurse who's really an RN. So that RN could have or an LVN, right, or LPN.
What's the difference in credentialing?
Okay.
RN versus LVN.
Okay, perfect question. So RN is a registered nurse, and LPN or LVN is a licensed vocational nurse or a licensed practical nurse. So there are LVN programs that are a little bit shorter, 1 year to 1.5 years on that, where they can really become an LVN fairly quickly. And then, of course, then you start your RN programs, and the minimum nursing degree for an RN program is your associate degree. So you would do your associate degree, you could become an RN, or you could do your bachelor's, which is what we offer here at WT as an RN. And there's quite a bit of difference between an associate degree RN and a bachelor's degree RN. And so, and we really pride ourselves in the quality of education we give to our bachelor's degree.
There's also a pay difference.
Correct. Yes, there is a pay difference. But for those who think, well, I just need to get in, get a job, and to get this done as quick as I can, and maybe they work as an LVN, they go through RN school and get their associate degree, we also have a really awesome program that is online, 100% online, and it will take them from that ADN to their BSN while they're working as an RN.
ADN is
associate degree.
Okay, and BSN is
bachelor's,
which is a 2-year versus a 4-year.
Right, correct. So say they go to, perfect example for local, say they go to Amarillo College, get their associate degree, do their test, and they become an RN. Start working at the hospital, making pretty decent money, pretty busy though, but they really wanted their bachelor's. Well, then they can join our online program, and in 1 year make their BSN and graduate with a BSN. So now they're BSN prepared. Then, if they want, they can come back and do an online program to get their master's. And their master's, they don't have to be just a family nurse practitioner. They can teach with a master's degree in nursing, so they can be an educator, they can be an administrator, they could do health business and run a business.
Opens up so many more doors. Just 1 more year.
Yes, 1 more year. Picking up a lot more opportunities.
And working while doing it at the same time.
It's so doable. I would say 100% of our students probably work while they come to school, and we know that's reality.
I love that. Real life practical skills.
Absolutely.
So, what are the steps after high school that a student should take to enter the field of healthcare? If they wanted to come to WT, we've kind of touched on that some, but if they wanted to come here, do they jump right into just basics, or how does that work? That could vary, I guess.
It can vary. If they come to WT, they would jump into the basics to get those kind of done with, kind of complete your English and your sciences and your histories and government and things like that. As you kind of tick those off the list, you get closer to where you're entering into the, say, nursing, for instance, the nursing program. That's why your grades are so important. For instance, this semester, or this last semester, before we did applications, we had over 100 applicants and then around 50 spots. So that's a pretty tight, competitive. So grades become a really big factor in that, and along with some other things that we look at too. But that's what they would do. They would start that process, declare that major for nursing. If they don't know for sure that they want to do nursing, one of the things we often recommend is just declaring a major for health science, because you're still taking the same courses. Nursing is really, we're heavy on sciences, so your chemistries and your anatomy and physiologies and microbiology, and then we're also heavy on, honestly, math, because we do a lot of drug calculations, we do a lot of IV calculations, and so those are the courses that we primarily look at grades and focus on. So it needs to definitely be something in the science realm.
Okay, great advice. So we're going to kind of switch gears. We've talked a lot about the career side of it and the educational side of it. So now, if you could give our students one piece of advice or two, just practical world advice, what would it be?
Well, nurse practitioners and nurses in general are the most trusted professional of all professions, and that's been for the last at least 2 decades. So the Gallup poll, which is probably one of the major survey units across the United States, takes all the professions, attorneys, pastors, legislators, all of those, and then ranks them according to what people declare as the most integrity or something like that. So for one, especially for our career for nursing, and it doesn't matter what career you're going into, honestly, I think 2 things. One, do the right thing, always. Even if you've got yourself into a jip or a bad situation, do the right thing, because you'll never lose with that. It'll always pull you out of that. We tell our students here, we're gonna make mistakes. We're gonna do something that, oh man, I wish I wouldn't have done that. Just be honest about it, fess up to it, learn by it, overcome it, don't do it again. So one, always do the right thing. And I think 2, for lack of a better word, I'm just gonna say have grit. Be resilient. I mean, you aren't gonna kind of like, oh man, I bummed that test, or, that course was, made it, do it again. Do whatever it takes. Be resilient, bump up, get grit, determined, give it all you've got. If you really want something and you give it all there's nothing to stop you from getting that. So I think those are probably the most important things. And I tell that to every, nursing school's hard. It's not like a walk in the park. It's pretty tough. So I tell that to our incoming nurses. I talk to them about being resilient and not giving up, and integrity and having that, and no matter what you do. So it's the integrity issue. I think just doing the right thing and taking the road that may not be the easiest road, but a road that you can do it, and staying positive, and not letting anything defeat you. I think that's probably the most important thing I would leave.
I agree completely with all of the above. Is there anything you want to add? Anything I missed or didn't cover with questions?
I don't think so. I think that would be,
Okay.
that sounds good.
Thank you so much for your time.
Yes,
today.
for sure.